In this film, an amniotomy, also referred to as artificial rupture of membranes, AROM, will be simulated. The following implements are needed for an amniotomy: a pair of non-sterile gloves, a Doppler device to monitor the fetal heart rate, and an amniotic membrane perforator. Take note of the small hook that is used to perforate the membranes. The perforation of the membranes can either be done using an amni-hook, as is shown here, or by using an amnicot, a finger stall with a plastic hook on the end. Only the use of the amni-hook will be demonstrated in this film. With the index and middle finger of the dominant hand, an internal examination is performed assessing the cervical dilation, the engagement of the presenting part, and the absence of vessels or placental tissue in the membranes. This is done to assess whether an amniotomy can be safely performed. The index and middle finger are kept in situ in order to guide the amniotic hook. Take note that the palmar side of the hand faces towards the maternal abdomen. The non-dominant hand is then used to insert the amni-hook into the vagina by sliding it over the index and middle finger of the dominant hand. Take note that the amni-hook is inserted into the vagina with the hook facing towards the healthcare professional's hand to prevent injuring the vagina and cervix. Once the amniotic hook is in contact with the membranes, it is rotated 180 degrees to place the hook directly onto the membranes. It is advised to keep the amniotic hook in contact with the membranes until a contraction occurs, since it is easier to rupture the membranes under tension. Rupturing the membranes before a contraction might dislodge the fetal head and may cause uncontrolled descent. Take note of the insertion of the amniotic hook with the hook towards the hand of the healthcare professional, the 180-degree rotation, pressing of the hook onto the membranes, and the pulling motion with the non-dominant hand in order to rupture them. Here, the technique of the amniotomy is demonstrated once more. The amniotomy is performed by pressing the amniotic hook against the membranes with the index and middle finger of the dominant hand, and then pulling the amniotic hook with the non-dominant hand. The amniotomy was successful if amniotic fluid is seen coming out of the vagina. It is advised to check the colour of the amniotic fluid to check for meconium, which will give it a green appearance, and check the smell of the amniotic fluid for signs of infection. Removing the amniotic hook is done by performing the previous actions in reverse order. The amniotic hook is rotated 180 degrees towards the index and middle finger of the dominant hand and is then retracted using the non-dominant hand. Take care to avoid causing soft tissue injuries with the amniotic hook when retracting it. The dominant hand stabilizes the head to protect it from sudden descent and subsequently makes sure there is no prolapse of the umbilical cord. Then the dominant hand is retracted. Lastly, the fetal heartbeat is monitored using the Doppler device to assess the fetal condition. Cardiotocography may also be used for this.